Okay, the topics for today are about bone grafting and sinus lift because आप अभी implants कर रहे हो. थोड़ा सा next level जाने के लिए we need to understand where to place implants when the patient does not have good quality bone. Okay, so bone grafting is required. Where all it is required, I'm just going to tell that to you through a infographic. So just let me know, can you see this image which I have projected on the screen?
आप ही देख रहे हो?
नहीं दिख
That
रहा
is
है?
not visible.
Okay,
नहीं.
okay, 1 minute. Uh, 1 minute. अभी दिख रहा है? अभी दिख रहा है?
हाँ, अभी दिख रहा है.
हाँ, अभी दिख रहा है? हाँ, ठीक है.
हम्म.
दिख रहा है, दिख रहा है. Okay, okay. I'm just going to put one image. Okay. So where all do we use the bone grafts? Why we use the bone graft? Why we use bone graft? Because वहाँ पे bone अच्छा नहीं है where we want to place a standard diameter or a standard length implant. Standard length implant and diameter implant we have already covered in the last Sunday presentation के at least this much implant should go. So if you are imagine if you are placing an implant in the lower 4/6 and you don't have enough bone to support a 4 mm by 8 mm implant, अगर उतना भी नहीं जाएगा, by following all the implant principles which we have studied in the first initial basic course was 1 mm of buccal width, 1 mm of lingual width, 1.5 mm and 1.5 mm from the tooth distance, at least that much we should have, and a length of a minimum 8 mm. So we can fit a diameter of at least 4 to 4.5 mm for a molar. If that much bone is also not available, we need to generate the bone. Okay, so in the lower, in the mandible, we have nerve, so we can't keep pushing the nerve down, so we have to generate the bone vertically up, right? But in the upper maxilla we have sinus where we can push it up and we can generate bone apically. Did you get that point? ठीक है. Then both of the areas will have bone deficiency in width, so we may need to generate in width. Okay, so we will start the bone grafting process the moment when we remove the tooth or when a broken tooth arrives at our clinic. So we will think about like an implantologist, not when we have to place an implant. We'll think like an implantologist when we are actually on the appointment of extracting the tooth. So obviously we'll do minimally invasive extraction, but at that time also we'll understand if there is no good attach gingiva, if there is no good bone on the facial side of that tooth which we are extracting, we will need to do something on that day itself so that when we reach the implant stage we are not finding much difficulty. So that area when we put the graft at the same time when we have removed the tooth is known as socket preservation. So socket preservation we can do immediately after extraction so that there is no collapsing of the bone segments. And even if there is no bone, we can add some membrane, we can add a graft so that our graft will turn over into bone. Then we need grafts understanding to do sinus lift in the posterior area. Sometimes we will also need periodontal bone graft where we have sites where angular bone loss have occurred and we will need to when we need to increase the width of the bone. Okay, so these are the areas where we will need to actually understand that we have to put the graft. Now that is why we need to understand what is graft, where it is put, how it is used, and what are the principles of grafting. So once we get this, then we ourselves will know how to do. See, my aim here is not to uh, my aim here is to give you full knowledge so that you can make your own decisions. Okay, if after course if I am the one who is going to take the decisions in your cases, then what is the purpose of doing this course, right? And I am not a consultant, so I derive no monetary pleasure of not keeping or not telling you anything and coming to your clinic. I don't have time to come to anybody's clinic, so I will keep it very simple so that you can decide. So we need to understand what are past principles. So these are basic principles of bone graft working. Bone graft, whatever bone graft we use, we'll come to that, what bone graft we use. But if we don't follow these principles in our flap design, in our surgeries, no graft will work. Okay, nothing will work. No matter you use BioOS, which is 9,000 rupees per vial, and you put a BioGuide membrane, which is another 9,000 rupees. So you end up spending 18,000 rupees cost price. It is not going to work if we don't follow these principles. So what are these principles? It is PASS. The first one is primary wound closure. For doing this, we need to understand how to properly suture the flaps. If our suturing is weak, if we have not practiced it properly, our knots are not coming well and they open up very soon. If we don't know what kind of material we should use, then our primary wound closure will not happen. After doing the costliest of the grafts, if in third day, fifth day or seventh day, the edges of the flap are open and some food particles and saliva and bacteria go inside the graft, it is going to completely infect it. So the principle here is that our edges should be completely closed. Okay. When the patient opens and closes the mouth, the flap is going to move slightly. Lingual flap, buccal flap, upper flap. The palate is not going to move. Everything else is going to move when they brush, then they. So we need to understand that our flap should have enough strength and enough mobility. Mobility means it should be able to fully stretch and go to the other side. Okay, if we have to apply lot of tension or lot of stretch, then eventually it is going to tear off. Eventually it will open the sutures or the gingiva will tear off from the sutures. So we need to understand how to achieve a very easy and movable flap. Like जैसे हम कपड़े को खींचते हैं ना, तो ऐसे खींच के अगर हम टाइट उसको स्टिच करेंगे ना, one of the days that stitch will come out fully, right? So it should not happen with our flap. This is the main aim of primary wound closure. So when we are doing the surgery, Navlika, we are going to do direct sinus lift for patient Manoj Ram on 19th August in the clinic. Okay, so there flap कैसे open करना है, कैसे raise करना है और थोड़ा सा कैसे release करना है to achieve the passivity and achieve tension free closure, I am going to tell you about. So remember this topic over there, that why we are cutting the internal layer of the flap, because we want to achieve passive closure, tension free closure, and how we are going to suture it well. That suturing also will teach you double layer closure कैसे करते हैं. That is for primary wound closure. Okay. There is a reason why we will do different kind of suturing in that case and not in our regular implant cases जहाँ requirement नहीं. Okay. Then second part is A, which is angiogenesis. So we need to understand how the flap is designed. Remember when we had done the first course, I told that flap जो होता है ना, उसका base wide होना चाहिए and where it ends incision जहाँ actually देते हैं उसका वो narrow हो सकता है. That's okay. But if we are going vertical incision, then base should be wide. Why is that so? So that adequate blood supply keeps coming in through that wider base into that narrow apex where we have given the incision and where we have placed the implant. Okay, so that's why gentle handling, and when we are reflecting the flap, we'll make sure that our flap reflector is resting on the bone, not on the flap, not on the gingiva. Otherwise what will happen, it will puncture, it will put pressure on the flap and some of the capillaries will die, or there will be ischemic necrosis of the flap. It is very common when we are doing new grafting surgeries and we tell our assistant to hold the flap reflector and they are not careful enough, they will not put it on the bone, they will just hold it lightly and lot of pressure will come on the skin or the cheek. So their pressure necrosis will happen in 5 minutes and blood supply will vanish. So then our flap can undergo necrosis. There again our flap can open up. So that we have to take care of. Okay. Then space maintenance. Sorry, one more line is there here. When we are putting the graft on top of the bone or inside the sinus, wherever we are placing, okay, we have to make sure that that area where we are putting the graft is actually bleeding. If it is not having any blood, like you know the structure of the bone from the first course, we have a cortical layer and we have a cancellous layer of bone, right? So on the cortical layer there is no blood supply, it is not going to give any blood. So if we just put a graft like this over here, it is not going to heal. The graft is going to be there forever. It is never going to convert into bone. Okay. Our aim of bone grafting is not to have graft when we open the flap again for the implant placement. Our aim is that graft should fully get converted into the bone. Okay. So what we do is we, for blood supply, we do something known as perforations inside the inside the cortical bone plate. We make holes inside so that our graft is getting the blood supply from inside the bone also. The cancellous blood will come out, and what flap is put from there also we are getting the blood supply. So both areas the graft is getting wet with blood. Okay, so that is meant by angiogenesis. Now when we put a graft inside the socket, it is already socket walls are going to bleed because the PDL has been torn off. So there the bleeding is happening. So there we don't have to create perforations. It is already getting wet. If we are putting the graft in the sinus, there also already it is an internal bone marrow cavity, empty cavity, the blood is going to come in. So there we don't need to create this. But anywhere else we are doing grafting, we will need to create, like if we are doing on the 4-6 region on the buccal side, if we are doing a graft, we will have to create some micro perforations in the bone plate. Okay, am I going very fast? Is it comfortable?
Sir, it's fine.
Okay. Now, next is space maintenance and stabilization. So space maintenance, these are the two S which is there in past principle. Space creation means we need to have sufficient space in the area where we are going to put the graft. If after closing the flap, so I've put a graft, if after putting the flap on top, the flap only compresses the graft and the graft gets displaced here and there, then again bone is not going to form. Okay, in sinus lift, why we choose to start grafting with sinus lift is already there is space maintenance, already there is space inside the body. Why we should start our grafting journey with extraction socket? Because already there is space, we don't have to create space. Okay, so that is the reason why I have chosen that first case what you do will be of sinus lift. Okay, लोगों को लगता है साइनस लिफ्ट बाद में करना चाहिए, तो डिफिकल्ट है, इम्प्लांट के बाजू में थोड़ा सा ग्राफ डाल देंगे तो इजी है. एक्चुअली इट्स नॉट डू इन ऑन द बकल साइड, यू डोंट हैव स्पेस, यू हैव टू क्रिएट स्पेस. Okay, so I'll teach you how to do that. But when space is already created, the sinus is empty, we just have to lift the membrane, put the graft is already having its own space over there to get stabilized into. Okay, then we put barrier membrane on top of the graft wherever we put. Even if we do the direct sinus lift, we'll put a barrier membrane. So barrier membrane solves two purposes. One is that outside flap cells, the epithelial cells or the collagen fibroblasts, they will not enter the graft and spoil the graft. Graft will be secluded from the tissue compartment, from the flap compartment. It will be more in contact with the bone. So membrane will actually protect the graft from food particles, from saliva, yes, but it also will protect it from the overlying gum tissue. See, if the gum is going to grow very fast, okay, as compared to the bone healing takes around 3 to 6 months. Okay, but the tissue healing takes place in 1 to 2 months. So if the tissue gets incorporated in our graft, then the graft is again not going to convert into good bone. It is going to have the cells of fibroblast and it is not going to support our implant in the future. So we need some barrier membrane, and barrier membrane solves two purposes. One is it will become like a dome on top of the bone. So that dome itself will act as a space. So there the space maintenance occurs and it also will create a barrier. Okay, these are the two functions. So stopping this share and I'm going to open one. Yeah. Yeah. So with this infographic, we can understand primary closure, where we give the proper suturing and we achieve the passive flap closure, not tension with tension. It is easy to close. Okay. Angiogenesis, where the blood is coming in the graft, either from the flap side or from the bone side. If it is coming from the bone side, we need to create the perforations in this area, in the cortical area. Then we have space creation and space maintenance, where we use a barrier membrane, or if we are doing sinus lift or socket preservation, already there is space. And there is stability. Now stability means this graft, wherever we are placed, it should not get displaced very easily. with the movements, regular movements of the patient. Okay. Sharing chala 1 minute. Okay. So if we have placed an implant, the implant should have good stability. ऐसा नहीं हो के implant only itself is moving and then it is moving the graft. Okay. ऐसा भी नहीं हो that we have placed a graft and we have placed the implant and on top of the implant we have placed a tooth also or a former also where the patient is playing with the tongue. So implant भी fail हो जाएगा, graft भी fail हो जाएगा, सब कुछ ही fail हो जाएगा, right? We should have it controlled and very tightly adherent to the bone so that it is not moving. So stability we will achieve with not loading the implant on the same day when we have placed the implant. That is basic. And we will place a good quality membrane on top of it so that it does not depress. So if the membrane is like this, if extra anything comes on top, it will just collapse on it. Okay, so we don't want it to collapse. Yeah, you want to take a break, you can take a break. कोई दिक्कत नहीं.
That's my daughter.
हाँ, I understand. कोई दिक्कत नहीं, कर लो.
Just 1 minute.
हाँ. ठीक है. So now we'll come to, so I know it is a very dry topic, but just go through this. ये उस दिन याद आएगा जो अभी एक बार बोला है. Same thing is going to get repeated throughout your mentorship program. यही चीजें हैं, बार बार रिपीट हो जाएंगी, आ जाएगा दिमाग में. ठीक है. Okay. Now we come to sinus lift and bone graft. Huh? So sinus lift, basically, what is the need? The need is when there is less posterior height in the maxilla, when there is tooth loss, ridge resorption, when there is maxillary sinus pneumatization, then we need to do sinus lift. Sinus lift का दो तरीके होते हैं. One is a lateral sinus lift or a side approach, and one is a crestal sinus lift. I'll briefly discuss all of these. Before that, we'll just understand what kind of grafts we put in the sinus and what is their timeline of healing. Okay, so when I discuss the timeline, abhi total na generally 3 to 6 months it takes for any good graft to mature and turn into bone. Even the bone itself, when we remove the tooth, it takes about 3 to 6 months for the new bone formation to complete. That is the reason we don't put an implant on it, on a case where we are not doing immediate implantation. We don't put it till 3 months. Okay, so we remove the tooth, then we wait for 3 months, and then we place the implant inside. We don't put it after 1 month, right? That's the reason, because still the bone maturation phase has not got completed. Bone maturation may complete in 1 or 2 years, but at least the basic cancellous bone, lamellar bone formation at least should start. So that is 3 months. So when we put the graft first 2 weeks are the most important, because there the blood clot is getting consolidated near the graft. ग्राफ्ट के आसपास ब्लड आ जाएगा, वो ब्लड और क्लॉट ग्राफ्ट के साथ कंसोलिडेट करेगा, और वही टाइम पे इफ देर इज नो मूवमेंट, if it is not getting displaced, then on the third week onwards it will start calling the bone cells from inside the bone and inside the blood. So what happens, it is very interesting to understand that body has given such a great mechanism. When you do some perforations or trauma in the bone cell, the blood which is coming out of there, and the inflammatory inflammation which gets created, the inflammatory cells which come, they understand that bone has got damaged. Okay, when the bone gets damaged in either tooth extraction or when we are perforating or when we are lifting the sinus membrane, all these three areas the bone is getting damaged. When it gets damaged, the bone blood, the itself, it knows that now I have to go and tell monocytes which are the inflammatory cells, to come in this area and mature into osteoblast. Okay, it knows. In case a tissue is getting damaged, the body knows, okay, I have to go call monocytes and tell them to form skin or gum or sinus membrane or bone. like the body so intelligently knows कि अगर trauma हुआ है तो I have to differentiate into this, that is known as mesenchymal differentiation. mesenchymal stem cells पढ़े होंगे आपने पहले, तो every tissue will have some mesenchymal stem cells. Those stem cells will differentiate and form into either of these two three things. Either it will form tissue, gum, fibroblast, collagen, or it will form bone, osteoblast, lamellar bone, or it will form sinus lining, or either of these things. So that happens in 2 to 8 weeks. So 0 to 2 weeks we don't have to touch that area at all, otherwise this mesenchymal migration will not happen properly. The inflammatory cells will not understand who to call, which person to call bone or to call tissue. Okay, if the graft keeps moving here and there in the first 2 weeks, or if we keep touching, we keep calling the patient, doing lot of irrigation or touching and checking the graft ke stable hai ki nahi hai, then it will form tissue. Okay, it will not form the bone over there. After 8 weeks, slowly the bone formation has started. So once on 0th day when you have done the surgery, you take the x-ray, you will see graft, complete graft. And after about 8 weeks, when you take another x-ray, you will start seeing some bone cells, and then after 16 weeks you will start seeing complete bone formation. Okay, yeah, so that's the reason why we want to wait for a little bit longer. Now bone के बहुत सारे types होते हैं, bone graft के bone graft के बहुत सारे types होते हैं. I'm again going to open a infographic here for easy understanding. We don't have to learn all of them, we just have to learn those which are required and which are available in India कि उसको कैसे use करना है. Okay, so I am going to point, you can see my cursor, no, this hand. हाँ, so bone graft substitute materials इतने सारे हैं. Of this majorly we use either natural bone or synthetic bone. Okay, mainly ये बहुत सारा यूज करता है. So naturally derived bone particles में we have either those bone grafts which are derived from the same person body. जिस पेशेंट का ट्रीटमेंट करे उसी पेशेंट का बोन लेंगे तो उसको ऑटोग्राफ्ट बोलते हैं. ओके, अगर हम किसी और पर्सन का, किसी ह्यूमन का ही, लेकिन किसी और की बॉडी में से बोन लेके किसी दूसरे पेशेंट के बॉडी में लगाएंगे तो उसको एलोग्राफ्ट बोलते हैं. ओके, या अब किसी और स्पीशीज का, ओके, लाइक हॉर्स, पिग, काउ, किसी और स्पीशीज का बोन लेके ह्यूमन बॉडी में लगाएंगे तो उसको जीनोग्राफ्ट बोलते हैं. ठीक है, सो मेजरली ऑटोग्राफ्ट, एलोग्राफ्ट एंड जीनोग्राफ्ट, these are the natural derived. Autograft is from the same person, allograft is from different person, so this is derived from the cadaveric human bodies. It is available in TATA Cancer Hospital also in Parel. वहाँ पे जो भी कैंसर पेशेंट्स का डेथ हो जाता है उनका पूरा स्ट्रिप ऑफ करते हैं, मसल्स हाइपोक्लोराइड में डालते हैं, वो इनऑर्गेनिक ऑर्गेनिक मटेरियल हटा देता है. ओनली द बोन, कैल्शियम फॉस्फेट एंड सम बोन मैट्रिक्स रिमेन्स. वो बोन्स को वो क्रश करते हैं, पाउडर बनाते हैं, उस पाउडर को वो स्टेरलाइज करते हैं, उसको एज मच एज एंटीजेनिक बना सकते हैं उतना बनाते हैं, पूरा ऑर्गेनिक मैटर निकाल देते हैं, इन्फेक्शंस, वायरस, सब कुछ, HIV, HIV सब कुछ निकल जाता है उसमें से. उसके बाद सिर्फ एक मैट्रिक्स मतलब एक स्कैफोल्ड जैसा बचता है विच क्लोजली रिजेंबल्स द ह्यूमन बोन. It doesn't have any cell in it, it just resembles the bone. It is known as demineralized, मतलब मिनरल भी हटा दिया है उसका, demineralized bone matrix ऐसा बोलते हैं. ओके, सो इट इज आइदर फ्रीज ड्राइड और नॉन फ्रीज ड्राइड या demineralized bone matrix. This bone matrix is very very good for it, almost matches the ऑटोग्राफ. ओके, सो फर्स्ट होगा ऑटोग्राफ जिसका सबसे अच्छा सक्सेस रेट है, बट ऑब्वियसली हमारे पेशेंट में हम 2 सर्जरीज करके और बोन कितना ही निकालेंगे, लिमिटेड क्वांटिटी इज अवेलेबल, राइट. एलोग्राफ्ट वी कैन प्रोक्योर, काफ़ी ज़्यादा क्वांटिटी मिल जाता है, इट्स नॉट वेरी एक्सपेंसिव ऑल्सो. टाटा बोन ग्राफ्ट तो 3000 का मिलता है. एंड इफ यू आर स्टेइंग क्लोज इन दैट रीजन ओनली, यू कैन गेट योर सेल्फ रजिस्टर्ड, एक रजिस्ट्रेशन कार्ड बनता है एंड यू कैन प्रोक्योर इट. ठीक है, यू हैव टू गिव द पेशेंट्स नेम ऑन विच यू हैव टू प्रोक्योर एंड यू कैन स्टार्ट प्रोक्योरिंग योर ग्राफ्ट फ्रॉम देयर. ओके, दूसरा एक कंपनी है US बेस का जिसका नाम है रॉकी माउंटेन. रॉकी माउंटेन एक नाम है कंपनी का विच इज मेकिंग एलोग्राफ्ट, मतलब ह्यूमन, दूसरे ह्यूमन स्पीशीज का ले रहा है. देन वी हैव लॉट ऑफ कमर्शियली अवेलेबल, बट इसका एलोग्राफ्ट का क्या एक मेजर प्रॉब्लम है, दैट इट इज नॉट अवेलेबल इन लार्ज क्वांटिटीज फॉर ऑब्वियस रीजंस. एवरीबडी विल नॉट वांट टू डोनेट देयर बॉडीज फॉर डूइंग दिस. then then that is why other substitutes were made which are known as xenograft. अब xenograft जो है that is derived from different species like cow, horse or pig, that is available in lot of quantity. Bios is a form of xenograft. Okay, it is a bovine bone. Bovine means cattle, means cow. Okay, so in some areas, you can say in some religions, in people may not like to use it, so be careful when you are telling the patient or using, take their consent. Okay, and then only use that. Then one more thing you have, it is chitosan, which is a compound like xenograph. It is a plant based material. इट इज अवेलेबल बाय द नेम ऑफ डेंटाफ्यूज. अभी लॉन्च हुआ है आईपीसीए कंपनी से, जिनका थर्मोसील का ब्रश आता है ना, उसी कंपनी से डेंटाफ्यूज. दैट्स ऑल्सो ओके, मतलब जस्ट स्टार्टेड यूजिंग इट, नॉट वेरी वेरी ग्रेट, जीनोग्राफ जैसा काम नहीं करता है, बट है एक एज अ गुड ग्राफ्ट. यू कैन यूज इट इन इनडायरेक्ट साइनस. आई टेल यू later on. ठीक है. Then we come to synthetic bone substitute which are not derived from any species or humans. It is directly synthesized in the laboratory. Those materials are having like nova bone. You have heard of nova bone? So nova bone is like a bioactive glass. Okay, that is available commercially. बहुत सारा बना सकते हैं. You also have साइबोग्राफ्ट. साइबोग्राफ्ट भी एक बहुत सस्ता सा ग्राफ्ट है. दैट इज हाइड्रोक्सी एपेटाइट. Okay, that also is available. So what the bone grafts companies try to do is they have tried to mimic the structure of the bone एंड द मिनरल्स ऑफ द बोन. ओके, बस वही दो चीजें कर सकते हैं. ऑर्गेनिक कंपोनेंट तो सिर्फ ऑटोग्राफ्ट से आएगा, सेल्स तो नहीं ला सकते कहीं से. ओके, सो दे हैव स्टार्ट ट्राइड टू मैन्युफैक्चर द स्ट्रक्चर. एंड अब आने वाले समय में वी आर ऑल्सो गेटिंग some kind of proteins which will help us to increase the bone formation, that is known as RHBMP2. okay, that is basically like a, जैसे आपने कभी इंटरफेरॉन या गामा थेरेपी के बारे में सुना है, जैसे वायरल फीवर होता है बहुत ज़्यादा, तो उन पेशेंट्स को एक इम्यूनोग्लोबिन थेरेपी देते हैं. yeah, so that is a kind of RHBMP2 is a kind of protein which the scientists have isolated from the human bodies, from cattle also, from pigs also, and they have converted it to be used alongside these grafts to as a chemical indicator or a chemical mediator to tell the body that okay, there is need of bone cells here, so you come and deposit bone. So that is like that is a natural phenomena which occurs in everyone. जैसे मैंने अभी समझाया bone grafting के इसके टाइम पे we make the holes. Extraction के टाइम पे we do a trauma, the PDL fibers are cut. So when this trauma happens, the body automatically knows कि यहाँ पे bone लाना है. Why it knows? How it knows? Because there it releases a chemical indicator known as RHBMP2. When that indicator goes in the blood after injury to those particular tissues, then the monocytes and the bone cells will come over there and start depositing bone. So this particular protein the scientists have been able to isolate and make it commercially available. It's very expensive, not available in India, but पता होना चाहिए कि ऐसा कुछ होता है. ठीक है. And then we also have growth factor based bone substitutes which we can make. We will make on in Manoj Ram in our case something known as PRF. PRF सुना होगा ना, platelet rich fibrin. Okay, so that is basically we get the blood out from the body of the patient, we run it in a centrifuge in a special tube, test tube. After 12 to 13 minutes of running and keeping it for 30 seconds, we will have a certain kind of a clumped plasma protein. So those proteins are also the ones which will work similar to RHBMP2. They will act as a chemical mediator and they will call the bone cells for faster healing. It calls the soft tissue cells also for faster healing. ठीक है, तो इसके बारे में भी बाद में हम बात करेंगे, but we'll because we are going to do that, that's why I'm just explaining you this particular topic. We are going to use xenograft bioos in this patient, so that's why you should know ये क्या use हो रहा है. ठीक है? Okay. Am I going too fast?
BioOS is which company?
BioOS is a company, is the name of the product. The company name is Geistslith. GEISTLICH. That is the name of the company. उसका product है BioOS. ओके. तो अब बाद में मैं आपको ये भी दे दूंगा नंबर्स, कहाँ से ऑर्डर करना है, क्या ऑर्डर करना है. एक लिस्ट बनाएंगे हम आपके साथ जब पढ़ाई करेंगे, तो इसके बारे में विल मेक अ चार्ट ऑफ विच type of graft which is commercially available you should have in the clinic and which one to use where. So I'll give you 4 grafts का नाम, वो ग्राफ्ट का डीलर का नंबर और एग्जैक्टली उसको कौन से केस में यूज करना है. ठीक है, सिंपल रखते हैं इसको. वी डोंट नीड टू स्टडी अबाउट 100 ग्राफ्स विच आर अवेलेबल. ये बस इतना इतना जान लो क्या क्या है अवेलेबल. ठीक है, ओके. सो हेयर इट इज शोइंग व्हाट काइंड ऑफ, एक मिनट जूम करता हूँ थोड़ा. Okay, what are the different grafts which are available? So first is the autograft. It is having good properties of osteoconduction, मतलब it will behave like the bone. It will have osteoinductive, मतलब it will induce the body to send blood cells over there, and it is osteogenic, मतलब it already has cells also. Okay, that is why it is best graft to be used. Okay, in certain cases osteoconduction का मतलब है that it will behave like the bone, like a scaffold, like a matrix. Okay, osteoinductive का मतलब है it has some components which trigger the body to send the blood cells to that, to the send the bone cells to that particular site. Okay, and osteogenic का मतलब है that it already has those cells which are required for bone formation. ओके, सो ऑटोग्राफ्ट में तो ऑब्वियसली सब कुछ होगा, हमने बोन ही निकाल के बोन की जगह दूसरी जगह पे डाला है. सो बोन में सब कुछ होता है. इट हैज द मैट्रिक्स ऑल्सो, इट हैज दोज इंडिकेटर्स ऑल्सो, क्योंकि ट्रॉमा हुआ एंड इंडिकेशन, वो केमिकल इंडिकेटर्स निकले, RH-BMP2 होगा ही उसमें. और ऑस्टियोजेनिक भी है, सेल्स भी होंगे, बोन सेल्स भी होंगे, राइट. बट इसका एक प्रॉब्लम है, इट इज डिफिकल्ट टू ऑब्टेन बिकॉज सेकेंड सर्जिकल साइड करना पड़ता है. क्वांटिटी इज लिमिटेड एंड इट इज वेरी फास्ट रिजॉल्विंग. 3 months में पूरा ही गायब हो जाता है, 2-3 months में सब गायब हो जाता है. सो वेर एवर वी नीड ग्राफ्ट, वी वॉन्ट द ग्राफ्ट टू स्टे फॉर अ लॉन्ग टाइम. देयर वी कैनॉट डू दिस. अगर बोन बनने के पहले ही बोन ग्राफ्ट वहां से चला गया तो स्पेस मेंटेनेंस वाला काम ही नहीं हुआ ना, स्टेबिलिटी वाला काम ही नहीं हुआ, जल्दी रिजॉल्व हो गया. तो वहां पे बोन सेल्स आने के पहले, वो नया बोन बनने के पहले, वो 3-6 महीने का टाइम होने के पहले ही वहां से बोन ग्राफ्ट चला गया. सो इट इज नॉट वेरी गुड फॉर आइसोलेटेड केसेस. हमें ओनली ऑटोग्राफ्ट कभी यूज नहीं करना है, ओनली ऑटोग्राफ, अनलेस एंड अनटिल इट इज इन द फॉर्म ऑफ अ बोन प्लेट. ओके, वो हम बाद में डिस्कस करेंगे व्हाट इज दैट प्लेटिंग, मतलब ऑटोजेनस बोन प्लेट्स. बट ग्राफ्ट जैसे हमने ऐसे स्क्रेप करके निकाला, या थोड़ा सा पीस कट करके निकाला, या थोड़ा आपने देखा होगा कभी व्हेन यू डू द एक्सट्रैक्शन ट्यूबरोसिटी निकल जाता है, या थोड़ा बोन का, इंटरडेंटल बोन का एरिया निकल जाता है, तो वो ऑटोजेनस बोन का पार्ट है. उसको हम क्रश करके, उसको मैनिपुलेट करके हम यूज कर सकते हैं, बट नॉट अलोन. ओके, दैट ग्राफ्ट इज नॉट गोइंग टू सस्टेन फॉर अ लॉन्ग पीरियड ऑफ टाइम. ठीक है. Then second one we have is allograft, which is the example is DFDBA या FDBA. DFDBA FDBA का मतलब है freeze dried bone allograft या demineralized freeze dried bone allograft. ये ऑस्टियोकंडक्टिव तो है ही, क्योंकि एकदम बोन के जैसा इसका मैट्रिक्स है, किसी और का ही बोन है ना. ये ऑस्टियो इंडक्टिव भी है बिकॉज इसमें वो प्रोटीन भी है, थोड़ा थोड़ा मात्रा में, इतना नहीं है, थोड़ा सा है जो बोन सेल्स को बुलाएगा. बट इसमें एक्चुअली लिविंग सेल्स नहीं है, होंगे तो इट विल क्रिएट एंटीजेनिसिटी इन द अदर पर्सन बॉडी, राइट. सो वी कांट डू दैट. आपने बोन मैरो ट्रांसप्लांट के बारे में सुना होगा ना, फ्रॉम वन पेशेंट टू द अदर, जिनको ब्लड कैंसर होता है उनमें देते हैं. सो बोन मैरो ट्रांसप्लांट क्या करते हैं, वो एक्चुअली किसी और का ऑटोग्राफ्ट इधर डाल रहे होते हैं. किसी और का लिविंग पर्सन का सेल्स एक्चुअली दूसरे सेल में, दैट इज ऑटोग्राफ्ट, sorry, that is a allograft, sorry, that is a allograft, it is from some other person but that person is living and that person is also living, they are injecting into the bone. Here we are not doing living bone, it's a dead bone, so it doesn't have living cells, तो osteogenic property बिल्कुल नहीं, ठीक है, that is very good graft to have. Then second is xeno, but availability is low. Then xenograft आ गया. Xenograft is basically the bovine bone. इसमें osteoconductive है क्योंकि bone तो सब जगह bone ही होगा. If you have other species also, bone तो bone है. काउ का भी फीमर अपने फीमर जैसा ही है, उसका बस स्ट्रक्चर अच्छा है लेकिन ना तो उसमें वो प्रोटीन है जो हमारे में है, और अगर वो प्रोटीन डालेंगे हम तो क्या होगा, अगेन इट विल क्रिएट एंटीजेनिसिटी इफेक्ट, सो वो प्रोटीन हटा देते हैं उसमें से, पूरा इनऑर्गेनिक कर देते हैं एंड सेल्स भी नहीं होगा ऑब्वियसली. अब जीनोग्राफ्ट का सबसे अच्छा एडवांटेज एंड सबसे डिसएडवांटेज भी सेम है, इसका रिजॉर्प्शन टाइम बहुत लंबा है, मतलब ये रिजॉर्व ही नहीं होता है. सो हम वहां पे यूज करेंगे जहां पे आइदर हमने इसको ऑटोजेनस ग्राफ्ट के साथ मिक्स किया है ताकि थोड़ा ऑस्टियोजेनिक और इंडक्टिव प्रॉपर्टी भी आ जाए और थोड़ा सा पार्ट ग्राफ्ट का जल्दी निकल जाए, थोड़ा रहे, या ऐसी जगह यूज करेंगे जहां हम चाहते ही नहीं कि रिजॉर्व हो. ठीक है, तो हम नहीं चाहते कि हमारा साइनस का मेम्ब्रेन हमने जो लिफ्ट किया वो कभी नीचे आ जाए, इसलिए हम साइनस में यूज करते हैं. यू गॉट दिस कॉन्सेप्ट नाउ? ठीक है, हम ऐसी जगह यूज करेंगे जहां पे हम नहीं चाहते कि बोन कोलैप्स हो या वो एरिया वापस कोलैप्स हो. तो ऐसा कौन सा एरिया हो सकता है एंटीरियर रीजन में जहां हम ग्राफ्टिंग करते हैं, वहां पे हम जरूर थोड़ा प्लम्प करना चाहते हैं जिंजाइवा को. वी वांट इट द बायोटाइप टू बी इम्प्रूव्ड, वी वांट लिटिल थिकनेस ऑफ द जिंजाइवा एंड द बोन, देयर वी डोंट वांट अ डिप्रेशन. ओके, सो देयर वी विल यूज some amount of xenograft so that resolve होके वो वापस बैठ नहीं जाए अंदर. It should maintain its volume, it should maintain its space. Okay, then we have alloplast. Alloplast is completely synthetic. इसमें ऐसे टाइप्स भी आते हैं विच रिजॉर्व इन 3 to 6 months, ऐसे भी आते हैं विच डोंट रिजॉर्व एट ऑल, बिकॉज इज सिंथेटिक, हम जैसा चाहिए वैसा बना सकते हैं. वन ऑफ द गुड ग्राफ्ट इज नोवा बोन विच वी कैन यूज इन दिस. ओके, देन वी हैव हाइब्रिड. हाइब्रिड का मतलब है it will be those PRF, basically the इंडक्टिव प्रॉपर्टी या कंडक्टिव प्रॉपर्टी को बढ़ाएगा. ठीक है, ओके, सो दैट्स इट मेजरली फ्रॉम माई साइड. हम बाकी का जो साइनस लिफ्ट वाला पार्ट है वी आर गोइंग टू डू ऑन द डे ऑफ द प्रोसीजर सो दैट इट इज एब्सोल्युटली फ्रेश इन योर माइंड एंड व्हेन यू आर डूइंग द प्रोसीजर एकदम आपको ध्यान में रहे. ओके, एनीथिंग यू वांट टू आस्क, एनी क्वेश्चंस यू वांट टू
Sir,
आस्क?
just one small doubt.
यस.
So you said कि xenograft में there might be people who wouldn't want other species bone in their mouth. Correct. In that case, what is the best option?
सो देखो, बोवाइन नहीं, अभी सब स्पीशीज से तो प्रॉब्लम नहीं होती है लोगों को. जनरली आई हैव सीन मेरे पास पेशेंट्स जो हिंदू या जैन पेशेंट्स आते हैं, दे डोंट वांट कैटल, बोवाइन नहीं चाहिए होता है. सो वी कैन ऑफर देम पोर्साइन ग्राफ्ट. पोर्साइन मतलब पिग सोर्स का, और वी कैन ऑफर देम इक्वाइन ग्राफ्ट. ओके, इसकी जगह पे, या
But
फिर
we have to inform them कि ये ऐसा है करके.
हाँ,
Like we have to.
मतलब आपको समझ जाएगा वो पेशेंट से बात करके कि वो पूछेंगे ग्राफ्ट
Okay.
कौन सा है, कहाँ से आया, तो आप बोलेंगे हाँ ये कुछ सोर्स से, तो बट पूरा प्योर होता है, ऐसे आता है, तो देन से नहीं नहीं मुझे ये नहीं चाहिए. लाइक आई हैव हैड पेशेंट्स हु आर फ्रॉम दैट कम्युनिटी. आई हैव पेशेंट्स हु आर मोहम्मडन्स, मुस्लिम्स, दे डोंट वांट पोर्साइन एट ऑल ऑब्वियसली. ठीक है, तो वो हम अवॉइड करेंगे. बट देन दोज के पेशेंट्स, देन यू डोंट डू एनी अदर एनिमल सोर्स और ह्यूमन सोर्स, देन यू शुड डायरेक्टली शिफ्ट टू एलोप्लास्ट, कि सिंथेटिक ही डालेंगे, आपको कोई देखने की जरूरत नहीं है, इट इज नॉट कमिंग फ्रॉम एनी स्पीशीज. ठीक है, सो देर यू कैन डू सिंथेटिक.
Yes. Nothing else as of
ओके,
now. वो
या
आएगा doubts जैसे
हाँ,
करेंगे वैसे.
तो आप वेडनेसडे तक एक बार वापस सुन लेना ये, और कुछ डाउट आएगा तो
Sure.
व्हाट्सएप पे मुझे टेक्स्ट कर देना. आई विल सेंड यू ऑडियो नोट फॉर एक्सप्लेनेशन.
Okay.
ठीक है,
Okay. Yeah.
चलो,
Okay.
गुड नाइट, टेक केयर.
Thank you. Bye.
थैंक
Good
यू.
night.